Causes of ascites in broiler chickens at advanced ages, 28-44 days. Ascites fluid accumulation in the abdomen is a common issue in broiler chickens at older ages, especially after 30 days. Causes: 1. Respiratory problems. Infectious bronchitis (IB), wind strike, Newcastle disease, mycoplasma (CRD). Respiratory diseases lead to oxygen deficiency in the blood, putting pressure on the heart and lungs, resulting in ascites. 2. Heart problems. Congestive heart failure due to oxygen deficiency. Heart enlargement caused by rapid growth. 3. Poor ventilation. Low oxygen and high carbon dioxide (CO) levels in the house. High humidity inside the house. 4. Nutrition. High protein or energy levels in feed. Selenium or vitamin E deficiency. Salty water or water with high salt content. 5. Liver diseases. Viral hepatitis. Chronic coccidiosis. Symptoms: swollen abdomen filled with fluid. Rapid breathing, panting. Lethargy and general weakness. Blue discoloration of the comb and wattles. Stunted growth. Treatment: 1. Improve ventilation. Provide proper ventilation. Reduce bird density in the house. Remove ammonia and carbon dioxide. 2. Medications. Diuretics like Lasix, furosemide, at 0.5 ml per liter water for 3 days. Antioxidants like vitamin E plus selenium. Liver stimulants like Ligavit or Hepatostim. 3. Treat the underlying cause. Respiratory antibiotics based on diagnosis: tylosin, doxycycline. Correct nutritional deficiencies. Prevention: proper ventilation from day 1. Provide clean water free of excess salts. Follow vaccination programs. Use natural immune boosters like garlic and lemon. Tip: treating ascites depends on early intervention and improving environmental conditions in the poultry house. Prevention is always better than cure.